Hello, and welcome to this webinar on healthcare data in the time of crisis. Today, I have the honor of speaking with Moshe Bar-Siman-Tov. Over the past 2 decades, Mr. Bar-Siman-Tov has served in a variety of senior government positions. Between 2010 and 2014, he was the Deputy Treasurer in the Ministry of Finance, where he oversaw health, human services, and the education budgets. In 2014, he was appointed as the head of the economic mission to Washington. He was called back only a year later to serve as the Director General of the Ministry of Health, where he served between 2015 and June of 2020. In 2020, he was appointed Senior Researcher at the Israeli Institute for National Security Studies, and only recently he was appointed Deputy CEO for Klal, one of the largest insurance companies in Israel. Good evening, Moshe.
Good evening.
It's a pleasure and an honor to have you with me.
As well, thank you.
So over the past 2 decades, you've served Israeli healthcare system in several different angles. You oversaw the healthcare budget, took part in selecting new medications for the healthcare national basket, and you successfully dealt with a prolonged national doctor strike. But then came 2020, a year like no other. And I'd like to take you back to March of 2020. You were at the helm of the Israeli Ministry of Health when what was arguably the worst healthcare crisis in the history of the country hit. And as the COVID-19 pandemic hit, I wanted to hear from your firsthand experience what the main challenges were to manage this crisis.
So we are talking about data. I think that the main challenge was taking dramatic decisions without proper data. We are not used to be in a situation where we don't know or we don't feel that we really know what we should know in order to take the decisions. And here we had to take decisions that we didn't take before, like asking people to stay at home, not to go to work, not to go to schools, etc., without having enough data in order to feel that for sure we are taking the right decisions. And I think, again, this was the most challenging aspect. And the other aspect was, again, to build the data in order to understand what we should do later on.
You know, during the pandemic, information collected at a national scale really enabled decisions in countries around the world. And what were the main challenges in Israel for creating this necessary real-world data to assess the state of the pandemic in Israel?
It was integrating different decisions that were not connected before. The national labs that was owned by the Ministry of Health were not talking with the HMOs in Israel. The emergency services in Israel were not fully connected to the HMOs or to the Ministry of Health. So it was all about interoperability, about making different systems, different type of data collections, again, to work together.
So these sound like substantial challenges that usually take months to years, if at all, to solve. How did you and your team solve these problems during such a short amount of time?
Again, when you need to do something, then you do it. It didn't take us days or weeks. It took months, actually. But since the Israeli system is relatively concentrated, I mean, I say that you can enter into one room, not in COVID time, about 10 to 15 people and steer the system, take decisions. So I think this aspect was one of our strengths running during the pandemic. So it was relatively easy to convince limited number of people to do the right thing in order to make the system work together. And of course that resources, it was not a limit. I mean, we had all the resources, all the money that we needed and human resources that we needed, we could use them.
Do you feel that there were important methodologies and technologies that were created during this time that make us better prepared for the next healthcare crisis?
I think, I don't know what's the next health crisis going to be, but I think that we did develop some strength that could be used not just in a pandemic time, but in a routine time as well. One of them is that we got used to use more telemedicine services, and we got used to use more data on a day-to-day routing of managing and directing the system. We saw that we have a relatively robust system of data, and we could make many uses of this data that we didn't think about before.
You know, despite these significant advances, do you think that there are other things that still need to be done, or especially from a technological perspective, what are we still missing?
I think that one of the challenges that we knew about them before, we knew about them during the pandemic, and they are still relevant, is connecting the healthcare system to another systems, to the social system and to other systems in Israel, and I'm sure that elsewhere as well, because again, we know that the impact of the social determinants of health on the health of the public health and the individual level as well is crucial. And we saw it during the pandemic. I think it couldn't be more clear like it was during the pandemic. And again, the way that we could use the data that comes from the education system or from the social services, other social services, social affairs systems as well, is crucial in order to take the right decisions.
So now that the pandemic is hopefully waning, what would you say are the main challenges that remain for aggregating data in this way during non-pandemic times, non-crisis times?
I believe that we can treat diabetes better if we take the social data or use the education system data as well. We saw it during the pandemic, but again, we don't need to wait for the next health crisis, but we can use it to deliver better services, better healthcare services in the day-to-day routine.
And what would be the main challenges to actually doing that?
I think that it's not just technology. It's about making different people from different organizations to work together. And I think, again, it's a global, it's a universal challenge. And then sometimes we want to say that it's all about technology, it's all about privacy, it's all about regulation. But we did learn that if there is a real need and a real will from the people, we can overcome all these challenges. And I think that once we have the experience of how this type of collaboration between different organizations contribute to the public health, we shouldn't just say that we will do it in the next healthcare crisis. We should do it on the day-to-day routine.
Okay. So in Israel, we have a unique situation where 4 HMOs cover our entire population. But yet, when patients try to get their care in different places, we have clear data connectivity and sharing issues. What do you think would be necessary to solve that challenge that we have within our healthcare system?
I think 2 types of solutions. The first one is, again, that the codex system would be as similar as possible. Switching to ICD-10 or even 11 in Israel is a crucial step. And another step is, again, developing system that can make this data be shared and data collaboration between different organizations, while every organization can keep the data within its premise and not move it into some data lake, etc. Because again, it doesn't work eventually.
So there are also data ownership issues in those cases.
Yes. Because people feel that their data, and they might be right, is so crucial for them, and they can make such a great secondary use within their organization that trying to convince them to move this data to some data lake is almost impossible.
So what are some emerging technologies that you've discovered that tackle this problem of aggregating data in a secure way that doesn't necessarily move it out of where it's stored?
So I think, again, all the interoperability systems are crucial. We have in Israel the OFEC system, and we are now switching to Eitan system. And it's a system that designed to interoperate and use the data from different resources, but it's for clinical use only. We can't use it for secondary use. But again, once we see that we have the ability, is building some other layers of security or maybe even of consent and use it for secondary use. We know that we can use data from different resources. So now we should do it for secondary use as well.
And how do you think the regulator, and you were indeed the regulator at some point, how do you think the regulator sees these technologies and what's its view on data sharing in general?
So I think that we should put at the top of our consideration how we can save more lives, how we can improve life, saving life, improving life. And once you put this at the top of your set of consideration, it's all becoming easier. Once we are convinced that sharing data can improve life and can save life, we can convince all the other parties. It could be health organization, it could be other government agencies as well, which are also part of this effort, of this regulatory framework process. So once this is your Northern Star, I think that you can succeed.
Yeah, I think that's fantastic. I think it's very interesting. Moshe, I'd really like to thank you for joining us this evening and for an insightful discussion. It was an absolute pleasure to have you with us. Please stay tuned to our upcoming webinars with world-leading experts in the healthcare industry. And don't forget to subscribe to Briya's social channels and look for us on Briya.com. Thank you very much.
Thank you.